Hi, everybody. I'm Dr. George Melillo, Chief Veterinary Officer, and I'm happy to be with you this afternoon in these crazy times. One of the things that's pretty amazing is that, in almost every state, veterinary services is considered essential services. And I think that's a great privilege, and with it comes great responsibility. I'm just in awe of the kind of all the veterinary teams, especially ours at Heart Paw and our Heart Paw partners. They are actually on the front lines in their hospitals, seeing pets who need care and maintaining the health of the patients, peace of mind of the clients, and also addressing a lot of the public health aspects that are pretty important for all healthcare providers. They're doing amazing work. They're kind of out there doing their jobs, taking this role very seriously, while they have families at home and are navigating a lot of the situations. We're also very aware of a lot of the people who are home and many people who are out of work and have a lot of concerns and are spending a lot of time with their animals. And, we want to just provide a forum for you to, address any concerns or questions you might have that come up during this time that we have together. Obviously, COVID-19 has taken the world by storm, and we're seeing very serious impacts and kind of the increasing cases that we're all kind of, none of us are immune to really in the news. We've made some changes in how we actually take the responsibility of really protecting public health, limiting the public-to-public access that is really kind of essential to flatten the curve that we're all kind of speaking to. One of the things, if you've come to one of our Heart and Paw centers or one of our partner hospitals, you'll see that we are always, on all cases for the last couple of weeks now, only doing car service or door service pickup. And the reason for that is we really want to minimize the amount of people that are coming together in one space. So kind of following the most stringent guidelines around that. I want you to know, though, that though you may not be in the exam room with the doctor or in the center with your pet, your voice matters and it is going to be heard loud and clearly. What we do is really kind of our team members, when you arrive, you phone us, text us, email us, and one of our team members, taking all the kind of proper measures, will come greet you, maintain the social distance, take your history, take what any concerns you have, what any issues you're dealing with your pet, bring the pet safely into the center, and there that pet will be examined by a veterinarian and other healthcare veterinary team members. We'll make assessments, we'll kind of decide what our next course of action will be, and then before we do anything, we'll talk with you and really kind of run by everything we're thinking, everything we want to do, get your consent to go forward with any care that's there. I want you to know that that room has been disinfected before and after your pet has been put in there. Our team members are using kind of the very stringent disinfectant protocols, and that's really kind of critical to what we're doing. So it's our way of really providing essential services while also keeping you safe, keeping our team members safe. So that's kind of been our approach. Now, I have one question from Kayla. You're not sure if you should bring your dog in or not. I think that's something a lot of people are facing, and especially now. I mean, many people are home with their animals and observing things that maybe they hadn't noticed before, or observing the frequency. I think the best thing to do is to really call, okay? Talk to one of our team members. I mean, they're all knowledgeable, they're all experts on determining things that obviously should be seen, because a big part of what we want to do in providing veterinary care is to make sure your animal isn't endangered at all, there's no risk to your pet, and certainly no pain or suffering is a big part of that. In some cases that might mean there's certain protective things that we need to do. Seems to be an uptick in people getting puppies and kittens right now. I mean, they're home. In my house, a little bit stir crazy. So looking at taking on rescuing an animal at that time. And in those cases, it may be very appropriate to get a vaccine given for a pet. The last thing we want to do is have somebody get, an animal, not do some of the care that we feel is essential, only to deal with a life-threatening disease later on. So it's a balancing act that I think is a conversation between you and your veterinarian. And I know they're all kind of trying to navigate this through themselves. I mean, they're just amazing people, noblest hearts in the world. I've always said that about veterinarians and the people who dedicate their life to really helping animals and valuing life that much of the world doesn't understand, let alone respect. So they are doing heroic things out there. A couple other things that I think it's kind of important for you to know is that anything we do, a big part of who we are at Heart and Paw and our partners is really around creating a low stress environment. Now, we realize that for many people, coming to the veterinarian can be a stressful ordeal, and for the pets, it can certainly be. So we've made some real significant changes in how we handle our patients. And a lot of that is giving them the time, getting them acclimated. In some of our new centers, the design features are there to really make it more of a kind of a home setting. And in our partner locations as well, just really emphasizing kind of patience, time, being kind of thoughtful with the animal throughout. There's never times that you can totally eliminate stress, but we try to minimize it to deliver the proper care that your pet needs in situations like that. There's many aspects of veterinary care as you're kind of going through it. Again, you may have concerns that come up. One of the things you might notice is around your animal's breath and the teeth and the smell as you're spending more time in your lap. I know my dog's kind of constantly with me during these stages. And, the kids will say, "Oh, wow, Dad, his teeth." And it makes you realize that, in some cases, getting good dental care at this point, if there's a chip, if there's a fracture, if there's a tooth that's bothering an animal, those are things that could potentially be concerns that you might need to address. And your veterinarian will talk with you. In some cases, something like that may be able to put off till a safer time, but in others, that's not necessarily the case. So that's kind of, been our approach and kind of how we're trying to handle some of the concerns that come up in these situations. Another big component is, just part of what we're looking to do is really preserve some of the protective devices. So veterinarians, we use masks and gloves and surgical gowns, just like in human medicine, the same type things. So really some of the decisions we are trying to make is really around preserving those. And in some cases, the states, we have to register with what we have. We've made some donations to human healthcare of some supplies we have. So that's kind of really a big part of it. I see another question about a little bit more about the curbside drop-off and pickup that we've started. Again, it's been something that the public has been so patient and considerate and understanding. I was a little bit nervous about that at first, but they've embraced it and they understand that we're all trying to really do what's best for us and to really kind of partner with us. And our teams, like I said, have been trained to do this in a safe way, one that's safe for your pet, one that's safe for you. You don't have to worry about any aspects of disease transmission during that. So that's been a big part of that for Jesse. I think you've asked that. As far as somebody else has asked about, should we give more baths? I think it really depends. We're coming into a very crazy season. This is really heavy when tick season starts in the Northeast, which is where most of our partners and our Heart and Paw centers are located. So ticks are already out, and it's been a very warm winter. So that only exacerbates getting some ticks and fleas out there. So bathing is something that's really important. You really want to watch for signs of fleas, watch for ticks on your animals. And in those cases, medicated baths may be necessary and appropriate. You certainly can't necessarily neglect your animal's coat or skin. So bathing, I think, again, is something you should do in consultation with the veterinarian, the groomer, to really determine, what is needed to be done and what can be done. I would say it's very important right now for things like heartworm prevention, for flea and tick prevention. You don't want to stop that because this is just kind of really the height of where the season starts to begin. The other thing to be very mindful is, a lot of times this is heavy allergy season. So many dogs and cats will have actually allergies, and we get respiratory often. They'll get very itchy skin, and a big part of that can really manifest itself as pathologies that can become painful and irritating and certainly disruptive to the animal. So, I think it's very good to kind of really, in consultation with the doctor, determine what is the best kind of care for that patient's skin and coat during this time of non-essential. If you're bathing at home, you got to be careful with that too. You don't want to dry out an animal's coat too much. So really talk with the teams. Make sure you have the proper shampoos and know what you're doing with that. It's good to see a couple questions come in, and good to see some familiar names looking. I think doing yourself grooming tips, somebody's asking about that, really be very mindful of getting water in the pet's ear. That's really one of the biggest components to getting ear infections. So it's kind of really important that I always recommend getting some cotton and even like a little Vaseline on the end to seal it, putting it into the ear canal so that you can know if the ear cotton is wet or not. There are cleaners that you can use for your ear post-bath to make sure you squirt in and kind of massage the ear so that it dries out the canal. If after you've given a bath, you notice an animal shaking the head or an odor or scratching, that's probably something you should talk with the veterinarian about because it is the most common way we see ear infections is by getting some water in the ear. There's also allergic components to that as well. Another question, is it okay for your dog to be in contact with other dogs, for example, at a dog park? I think there's always, the big thing to remember when you see dog parks or situations like that, you want your animal to be properly vaccinated. And certainly things like distemper parvo, rabies, kennel cough, even the influenza vaccine in certain areas, you want your pet to be protected. Some pet parks have rules, some don't. So you want to be mindful of that as well. Parasite prevention, I think, is critical when dogs are interacting with one another. So that's very, very important. And obviously good sanitation. You want to watch around droppings, make sure things are cleaned up. Make sure your animal has regular fecal exams to look for parasites inside of that. Some good questions. It's awesome seeing some familiar people checking in. It's very cool. The other thing I do, want to talk about, at our centers is, we do have these prevention plans that when things return to normal somewhat, we'll be doing a lot more kind of welcoming people in for just simple regular wellness checks that are really important to we feel, the life of the pet. So things like yearly blood work and urinalysis, all things designed to keep your pet healthy and safe and long-lived. The one thing I love about our plans, it's really a conversation between the doctor and the client, and you two partnering and deciding what your pet needs, paying for only what your pet needs, and really making out a plan to make that happen. I think Ryan Cunningham asked about allowing dogs to greet other dogs on daily walks. It's more about your social distancing. I think it's the dogs. There's no evidence of COVID-19 in dogs at this time, and it's been looked at. I know there have been a case in China that was reported as having a positive that turned negative. But at this time, all the evidence tells us that there is no risk of animals getting the COVID-19 virus. So in those situations, I think it's using the same precautions around protecting your pet. from any diseases that they can transmit. And obviously, dogs can transmit other diseases to people. We know about rabies, leptospirosis, there's parasites. So whenever your animal is kind of interacting, you always want to use appropriate hygiene. That's where a lot of this hand washing with hot water, soap, doing it often, that's good care anytime you're with your pet and anytime they're outside and exposed to other animals. Not necessarily for COVID-19, because again, we have not seen any evidence to support an animal being able to get COVID-19 from a person and transmitting it to a person. But it's just good precautions in general. There's a question here, if they have the first series of rabies shots and all other shots are up to date and you're not having a problem, then if your vaccines are up to date, you're fine. And the rabies, I think it depends if there's a potential rabid case in the area. And potential exposure with your pet, we recommend boostering those. But those are decisions that should be done, Pauline, with consultation with your veterinarian. And by calling them, we should be able to answer that pretty efficiently for you based on what your pet's status is. I think the big thing I want to say, though, is, you're sitting home. We're all dealing with so much. I mean, the one thing is collectively as a whole world, we're dealing with the same kind of uncertainty and stress and just trying to figure things out, right? I think what I would recommend you do always is call the doctor. Let them know that, what you're struggling with. We want to be there. I mean, we're essential workers, which is, again, privilege, but responsibility. We want to be there to answer your questions. And if if the answer is to bring it in, we're going to take every precaution to deliver that essential care. If it's something we feel we can wait, and we can always revisit it. And if, even if we collaboratively decide, probably something we can wait till things quiet down and you're not feeling it, call back, right? That's really kind of an important aspect, just that communication with us. I think I have another question. Somebody going back to normal and separation anxiety. That's a really good question that could really come up. Dogs spend a lot of time with us. They're very sensitive to changes in their environment. But there are, other services out there. I think some of the daycare and play services, if they're available, I think they're a great way to enrich a dog and kind of make their life a little bit better. I think if a dog is active and engaged, they tend to be happier pets and have less probably behavior issues kind of going forward. So, those are ways to really kind of look forward to it. There's dog walking services. There's certainly ways to kind of make up when you go back to work, the time that your dog might have a little challenges, with enrichment toys and making extra walks and creating special times. Changing from one routine to another is always something that certain animals seem to have more problems with. But, again, talk it over with your doctor, with the veterinary team, and they'll have some great suggestions around that as well. It looks like the questions have slowed a little bit. I really want to thank you. Thank you, first of all, to all the veterinarians. I see a few veterinarians on the messaging here in the chat. Thank you again for providing this valuable, essential care. You really are my heroes. Thank you for the people that are just looking to do what's best for their pets and their families, and for reaching out. And please continue to reach out to us. We're here to help. We're your partners, and we're all in this together. So thanks to everyone.